Welcome back to Get Your Man On. We've got men's health expert Justin Turner, expert in treating erectile dysfunction, low testosterone, physician's assistant, seen thousands and thousands of men for this stuff. It's been incredible hearing some of the things I had no idea about in these segments. We're going to talk now about what treatments there are for testosterone. Justin, so we know causes of low testosterone. We're understanding what it does, how it affects us, some of the side effects of testosterone replacement therapy, some of the benefits of replacement therapy. Tell us how we can treat it.
Yeah, I mean, so the gold standard when a guy's deficient in testosterone is replace the testosterone. You can give testosterone through IM injections. You can give it through gels or patches. Or you can do an insert, which we call pellets, where we make a small incision and actually implant pellets into the body. You can also go about it in an alternative way. Some medications there would be Clomid or HCG, drugs that are not testosterone, but either block the conversion of testosterone to estrogen and raise your testosterone levels, or actually stimulate the testicles to produce testosterone. And so personally, my favorite way to introduce testosterone is the injections. I typically use weekly injections on my guys. Some guys come by once a week and we give them a shot. Other guys, we teach them how to do it and they do it at home. But I feel like, especially at the beginning, it gives us the most amount of control on how we're doing it. It introduces the body the quickest way to relieve the symptoms. And we can kind of change on the fly as far as the milligrams, how often we give the injections. And I just personally see the biggest benefit with the quicker results there. Gels are fine. Gels are FDA approved. They work really well for some guys. Only thing I'll say with gels is just, you got to be careful. There's some transfer to women and children. So when you put the gels on, and so just a lot of my guys are proud fathers, like we are. And so, putting it on and having to be really careful about transfer is a big deal. But the products work. I'm not the biggest fan of patches. Just I see a lot of skin irritation, also kind of hard to keep them going. Also just compliance. Guys leave one patch on for 5 days, the other patch they leave on for a day. And so I'm just not the biggest fan. Pellets are great. Pellets allow us to get away from the weekly injections or applying something. They get implanted. They can last 3 to 6 months. Where I think pellets make the most sense are guys who've already been on testosterone therapy. We know how they respond. We've evaluated them for results and side effects. And again, we know the outcome. And so when we do the implants with the pellets, we get that good control for 3 to 6 months. And so I'm not the biggest fan of doing pellets the first time I meet a guy. Even though some of my peers are and do really good with their patients through it. But they're all great benefits. The alternative therapies, some guy, I'm not a fan of calling them natural therapies, but when we talked about fertility earlier, Clomid and HCG can most definitely not lower the fertility that we can see with actually doing testosterone therapy. And so I'm a big fan of Clomid and how it works for some of our younger guys. And then HCG.
What is Clomid? Is that how are you using Clomid then?
Yeah, so Clomid is a fertility drug, mostly used in women during that process. But it actually works in the male body by intervening between that conversion of testosterone to estrogen. And just like many other drugs, might have some unknown processes. But when you limit some of the conversion of testosterone to estrogen, testosterone levels will rise. And so it's a very effective drug, normally a pill that you take every single day or every other day. We all have kind of different ways, the way we prescribe it. But I've seen it take guys from really low levels of testosterone and increase them to really good levels, and I've seen it relieve the symptoms.
Gotcha. As far as side effects with that, you got any things that happen there?
Yeah, I mean, so you're going to see the nausea, dry mouth, abnormal vision, very general side effects that are very common with most drugs. But the short's pretty lit. I mean, the list is pretty short. It's a well-proven drug that's relatively safe for sure.
Gotcha. Is that so? Talk to me a little bit about like off-labeling. Like, is any of this stuff off-labeling? Like, how do you determine like what's an off-label versus FDA approved, all that stuff.
Yeah, so all of this can be off-label, and so testosterone itself, when you choose to when you see a guy and he's 100, that's no off-label. You're treating him for the indication, but you treat a guy who's very symptomatic and he's 300, and you just want him to feel better. I mean, there's some off-label approach of giving him testosterone to just make him simply feel better, not really even worried about increasing the levels, just trying to make him feel better. When you're dealing with the other drugs I mentioned, HCG and Clomid, those are absolutely, by all definition, off-label drugs. Those are drugs that weren't initially indicated, not really evaluated by the FDA for that purpose, but in general, from the medical community, agreed upon that they're safe drugs and a very valid. Off-labeling sometimes can have it's not FDA approved for that. Yeah, I mean, but as a provider, we are absolutely given the authority to use drugs that are approved by the FDA for other purposes, as long as we deem them safe. And Clomid and HCG have been proven to be safe.
Gotcha. So you're saying that off-label usage is normal, common practice?
Yep.
In all of medicine?
No, absolutely, for sure. We see that in my world with the ED drugs that we'll use. We'll see it with the premature ejaculation, which we haven't really got into that yet. But the number one gold standard across all medical communities is use the SSRIs, which are drugs that are antidepressants, which have no indication from the FDA to treat premature ejaculation. But it's what we all do first.
Really? So a drug so now that we're talking about it, we got to talk about it. So an SSRI, which is like a Paxil or something?
Paxil would be a really good sample. Selective serotonin reuptake inhibitors, Paxil, Prozac, Lexapro. There's a long list of safe drugs that have been out for a long time.
So you can take that drug that's made for a mental condition and use it for premature ejaculation.
Absolutely. Yeah. We always try to use it kind of on demand, where guys are just taking it before sex. And so if they're having sex once or getting pushed by you into twice a week, then we'd rather them take 2 pills. But we will also shift into a mode where we take it daily if we need to. It's all based on results.
Gotcha. And so will they get antidepressed too?
Yes. After a couple weeks, those drugs will take an effect. They are very safe drugs, long track record. But in my world, I am worried about decreased libido and weight gain. I don't want to decrease desire to have sex. I'm in the business of doing the opposite of that. And I don't want my guys to gain weight. I want my guys to maintain healthy weight and be healthy. So there most definitely are some things that we have to watch out for. And we do that through close follow-up.
Gotcha. And HCG for testosterone you're talking about.
Yeah. So HCG, the pregnancy hormone, that's what most people know that drug as. The male body actually has no HCG in it, but if you introduce it into a male, the male body has no ability to tell the difference between HCG and LH, which is one of those pituitary hormones that leaves the brain and goes to the testicles to tell the testicles to produce testosterone. So when you introduce HCG, you're introducing an on signal to the testicles. And so you can use HCG as a standalone treatment for low testosterone. You can also use it alongside testosterone replacement in order to keep the testicles from shrinking. One of the side effects of low testosterone is atrophy of the testicles. And if it's because the brain doesn't signal the testicles to produce testosterone because it doesn't need to, by giving HCG, you can keep some of that signal on. And there's some other research that says it might have an effect on maintaining fertility while you're using that testosterone.
Gotcha. Talking here with Justin Turner, men's sexual health expert, treated thousands and thousands, tens of thousands of men for ED and low T, talking about off-label usage and testosterone replacement therapy and how to use it. So you always try to go back to injections. That's kind of your go-to.
Yeah, again, that is the gold standard if there's not a reason. And again, fertility being the largest reason or a known side effect from previous testosterone therapy, I'm going to most of the time recommend we start off on weekly injections. And I'm going to kind of watch the follow-up and go from there.
Gotcha. And then are those injections can you mess with them? Can you add other things into them? Can you, what do you do? Are they commercial versus compounded versus can I get them from anywhere, any pharmacy? How does that work?
Yeah, I mean, so testosterone is commercially available. We use commercial testosterone. We also use compounded products. We use pretty standard mixtures of, testosterone. Cypionate would be, probably my favorite version of testosterone. But we will blend it with other forms once we see how a guy responds. So, I mean, the answer to your question is you can get it commercial. It's a commercial available product. You can also get it compounded. As far as what we can do with it, again, we draw that blood and we watch it, and we absolutely adjust how we're doing treatment. I kind of told you weekly injections are kind of my starting point. I have kind of a starting milligram that I really believe in, that I believe takes care of most our guys. But once we do that follow-up, we will increase dose. We'll increase frequency, start giving it every 4 days with a lower dose. We'll spread it out to every 10 days. So we customize as we move forward based on how a guy feels.
Amazing stuff. Makes it really important to see a provider who knows how to take care of low testosterone and deal with testosterone replacement therapy. Sounds like it's not as simple as just jumping into a gym locker or a gym bathroom and giving it to your buddy. You need a provider, you need a test, you need to talk about it, make sure it's right for you, understand the benefits, understand the risks, and then make an informed decision on how to do it the correct way. Justin, thank you so much. Let's come back after the break and let's talk a little bit about some of the stories. Let's hear from our voicemail anonymous line, get some of the juicy things, and we'll be back.